Hi, my name is Christy Sherdahl, and I work at the University of Virginia Health Systems. I'm a registered nurse that works at the Outpatient Surgery Center and has been trained to circulate and scrub for teams such as GYN, urology, and general med. I am also a backup scrub for labor and delivery to do C-sections. I've been thinking about surgery of late and how it relates to society. Society would like to have fast and safe surgeries so they can get up and get back to work and to continue living their life close to pain-free and infection-free. But what would those patients feel if they received a call from the hospital stating that the instruments they were using for the procedure was infected, contaminated with HIV or MRSA? In 2018, a hospital in New Jersey had to do just that. They had to call over 3,000 patients and tell them that they could be infected with HIV from instruments. And they all had to come in and get tested to see if that was the case. Or how would they feel if they got a phone call stating that the instruments used on their procedure was contaminated with blood or someone else's tissue or hair? Again, unfortunately, a situation like that in Denver happened in 2018. How would you think they feel or felt getting that phone call? And who is actually responsible for cleaning and processing these instruments correctly? What can be done to reduce or to prevent these kind of situations from happening again? The area is called sterile supply or sterile processing, or a combination of both, are made up of individuals who are responsible for cleaning and caring for instruments used in surgery. These individuals usually have a high school education, can read at a 12th grade or so level, and have had other jobs, or maybe this is their first job. But other skills about what they need to know needs to be given through some kind of educational program or certification program so they can be shown to be competent in knowing how to fix broken instruments, how to clean them, how to package them, and give them to the team safely and securely. And also to understand how pathogens can affect the patient in getting an infection. So these individuals need something just like any other person who's being trained for a particular kind of job to give them the hands-on and the knowledge to be able to care for these instruments. I have a 3-step program that is supported by various projects and various situations where research has shown that this can help the situation and in decreasing the infection rate overall. 1. Encourage the individuals for signing up for a certification program. A certification program can start anywhere from $5,000 to $10,000 and can take from 6 months to 12 months to be certified in processing and sterilizing instruments. And it's just not hands-on. They also learn about anatomy and physiology. They learn about infections and viruses. They learn what instruments are used for what surgery, and importantly, the why. Why do these surgeons need these kind of instruments, and why do we really need to care that these instruments are clean and not broken? And I wanted to quote from an article in Sterile Processing, Where We Now and What Lies Ahead. And the author, Dr. Berg, has some good insight about education and certification. Quote, Initial and ongoing education is critical, not only for processing, but also for roles and responsibilities of the personnel. There needs to be a robust orientation program for new personnel and ongoing competency assessments for all personnel. Sterile processing leaders must be required to remain up to date on current standards. We need to be sure that lead technicians, supervisors, and even managers are competent themselves before they're allowed to perform competency assessments of these certain standards. End quote. He goes on later to talk about certifications and how, quote, certification should be required as an ongoing education standard, and also shows a need for requirement and for best practices. When we follow standardized procedures, we're contributing to the prevention of disease transmission and surgical site infections, end quote. 2 states, New Jersey and New York, do mandate that people are certified for sterile processing. It is a benefit not only for the hospital, for the individual who gets trained. They not only get an increase in pay, but an increase in competency. Step 2, hospitals need in-house training for those individuals to continuously understand the process, the changing world of instruments, and new procedures that have been found to better the processes of sterilization and packaging. And be able to get tours and understand the hospital's setting. Just like RNs, we go through a process of orientation. We get our hands on IV pumps, or those who are in the business world get a chance to tour and look over books. So should the people who are responsible for instruments that go inside of people. And 3, there should be an openness to communicate, training to how to be able to communicate with the team of surgeons, with the team of nurses and the managers and the charge nurse and the anesthesiologist about problems that have come up about the instruments. And maybe because of that openness, then problem solving can occur, and people will see ideas in a new light, and we can all work as a team and decrease these infections and issues for patients. The barriers, though, that I can see to implementing this kind of regimen, this kind of practice, would be money. Like, where is the money going to come from, people will ask, or what is budgeted for the unit? And of course, time. Who is going to teach the classes? Do we have money to hire teachers to teach these individuals? Is it really important? I can see that CFOs and donors and maybe even directors may be against this venture because of the money aspect. They look at it as, oh, there's more money to hire people, more money for resources that they may see that the hospital doesn't have. But in the long run, it's going to save a lot of money a year. Patients already spend between $30,000 to $500,000 on infections they receive from surgery and from other instrumentation venues that's been infected with some kind of virus or visible garbage. And it will not only do that for them to decrease that infection, but it will help surgeries start on time. More surgeries will be signed up because of the saving of time if instruments are cleaned and processed and packaged and given correctly for the type of surgery that's going to happen. And like I said before, the patients. The patients want to see that they are just not a number. They want to be cared for as actual individuals. They want to be heard, that this kind of problem should not be let go and not dealt with properly. And if the situation doesn't improve, the public may boycott the hospital. And if it's state-run, politicians will get involved and may rally to say, don't go here because of lack of safety and cleanliness. And in the end, the hospitals may have bad reputations, which equal bad press, may equal loss of profit and lost jobs. So who matters in the end? It goes right back to the patient. The patient needs to know that they will be safe and secure, that they will be satisfied. In the end, they will have a peace of mind. These steps, if they are to be taken seriously and implemented, will greatly benefit society because they will have competent individuals who are processing and cleaning and fixing and making sure that these instruments are safe to be used for their surgery. That way, if we implement this, no one will have to get a phone call.